Thank you, Senator Patrick, and I call Senator Urquhart.
Thank you, Madam Acting Deputy President. In Tasmania, the state that I represent, the government has commissioned its own modelling on the impact of COVID-19 once the state opens up. As a result of that, the government, and I might add it's a Liberal government, has made the decision not to fully open up the state until 90% of the eligible population has been vaccinated. That's quite a different plan from the rest of the country and quite a divergence from the national plan. This Tasmanian-specific modelling is due to be finalised this week. That really makes me wonder what more the Tasmanian Premier learnt at National Cabinet that made him make this decision. He did reveal the Doherty modelling figures on likely coronavirus deaths if our island reopened at an 80% vaccination rate. Over the first 6 months, it would result in 14,900 cases, up to 590 hospital admissions, 97 intensive care admissions and almost 100 deaths. He also made it clear that it was not an acceptable risk to take. Our doctors and nurses and paramedics are telling us loud and clear that moving to the next stage of the National Cabinet plan will put a huge pressure on hospitals around the country as lockdowns are lifted in New South Wales, Victoria and the ACT, and borders are opened in the COVID-free states like Tasmania. There is revised modelling on the capacity of health systems and hospitals to cope with an influx of COVID-19 hospitalisations as Australia reopens. It models how many cases, hospitalisations and deaths can be expected, and the Morrison Government is refusing to release it publicly. Modelling for the whole country that outlines the impacts on our hospitals exists. We paid for it, our taxes paid for it, but the Prime Minister is keeping those details secret. We have a right to know. Our hard-working healthcare workers have a right to know. Our paramedics and nurses, those working shift after shift, seemingly endless hours of overtime, have a right to know, and the Australian people have a right to know. In the last months, we've seen our hospitals, particularly in Sydney and Melbourne, at breaking point. And in Tasmania, even without COVID-19, our hospitals are at breaking point almost every single day. That's right, when the state is COVID-free. And we are starting to see the lag from the last 18 months because people weren't seeking the treatment when they should have. And as COVID does come into Tasmania, that pressure on our health system will increase. It is not acceptable for Mr Morrison to keep this modelling a secret. And it is not acceptable for Mr Morrison simply to pretend that this is all the state's responsibility. He's done that far too often throughout this pandemic, with the vaccine rollout, with quarantine, and we could go beyond that with everything else. The culture of avoidance and secrecy that this Liberal government has cultivated has reached extraordinary heights, to the point where we're even here today demanding on behalf of the people that we represent to be allowed to see the revised modelling we have paid for that tells us how or if our hospitals will cope. I have absolute faith in the dedicated health professionals in Tasmania. Daily they pull out all the stops. They work double shifts and more, tending to Tasmanians with their care and expertise. But even on a good day, our hospital system is crying out for more staff and more resources. We've seen a 30% increase in patients on the elective surgery waiting list and ambulance ramping at unprecedented levels. Years of underfunding and bed blocks have seen it lurch from crisis to crisis. And that has left us in a position where the Premier is not prepared to commit to easing border restrictions until we are 90% vaccinated. That's how worried he is about the pressure that will be brought to bear on our health system. We all deserve to know what that pressure will look like. And then we deserve a Prime Minister who will sit down and maturely, constructively work with the state and territory governments to make sure there's a plan to keep our hospitals safe and strong. What a real leader, a real Prime Minister, a Prime Minister who understands his role would do is to be constructively talking to the states and territories about what they need to cope, not playing spiteful politics and playing favourites. What a real leader would do is take some responsibility. What a real leader would do is not run and hide, and that is what this Prime Minister is doing, running and hiding from crisis to crisis.